Vaccine testing paused by Johnson & Johnson, because of unexplained illness / in participant. Donald Trump must have finally realized that the coronavirus vaccine is just not going to be ready by Election Day, no matter how much he promises, as he has finally stopped talking about it. Of course, he had COVID-19 and is pushing a therapy that he took, so perhaps it's just no longer a priority for him. It's a good thing he's not actively pushing it, though, as there is bad news on that front. One of the promising vaccines, by Johnson & Johnson, is on hold after a trial participant had an undisclosed illness. Outside researchers running the clinical trial that included 60,000 patients, received a document that stated a pausing rule had been met. Additionally, the online system to enroll patients was closed, and the Data and Safety Monitoring Board was going to convene. This is according to the document obtained by Stat. Johnson & Johnson confirmed the news that the study was paused. The company said it was due to an unexplained illness in a study participant. It did not provide any other details. We must respect this participant's privacy. We're also learning more about this participant's illness, and it's important to have all the facts before we share additional information, said Johnson & Johnson in a statement. Just to be clear, the company noted that this type of thing, illnesses, accidents, and other adverse events is likely in a clinical study. This is, of course, why a set date cannot be adhered to and why the companies conducting the vaccines didn't want to make promises. It is likely to happen. Johnson & Johnson also discussed the difference between a clinical hold or formal regulatory actions, as that can last longer. This particular vaccine is not under a clinical hold at this time. The company noted that it typically tells the public about clinical holds and doesn't do so with study pauses. Late Monday, the Data and Safety Monitoring Board convened to review the pause on the vaccine. Johnson & Johnson explained, it is not always immediately apparent whether the participant who experienced an adverse event received the vaccine being studied or a placebo. Clinical trial pauses, while not being as frequent as study pauses, do happen and aren't that uncommon. Sometimes they only last a couple of days. However, there is such great attention being paid to the coronavirus vaccine trials, that everyone is talking about these trials. A source familiar with Johnson & Johnson's trial said that given the size of the trial, with 60,000 participants, it's not surprising that it would encounter study pauses. Even if this current one is resolved, it could face another one before the trialing stage is complete. If we do a study of 60,000 people, that is a small village, said the source. In a small village, there are a lot of medical events that happen. There was also a hold placed on another of the coronavirus vaccines that was being developed by AstraZeneca and Oxford University. It was put on hold because a patient in the United Kingdom experienced what was suspected to be an adverse reaction. It's believed, however, that the patient had the spinal cord issue myelitis. The trial was only on pause for about a week in the UK. However, it's still on hold in the United States. Johnson & Johnson entered Phase 3 of the trial when it started enrolling volunteers. The plan was to enroll 60,000 participants in the US and other countries.